This is the second lecture in the endocrine system. It's going to be talking about feedback loops and how you're going to manage stress. Please make sure that you see the first so you understand about stress, the two different kinds of stress, acute and chronic stress. And this lecture is going to be talking about the management of stress. Feedback loops come in two different varieties, flavors, negative and positive feedback loops. And talking about stress management, the endocrine system will help reinforce how to differentiate negative and positive feedback loops. First question, what controls hormone stimulation? What mechanism shuts off the hormone production? Is it receptors in the neocortex of the brain, or is it feedback loops regulated by the endocrine organs? The answer is feedback loops. You have two types of feedback loops, positive feedback loops and negative feedback loops. This doesn't connotate good or bad, but it's easier to remember if you think of someone in the background saying, good job, way to go, and pushing you forward as a good job, as a positive feedback. And then a negative feedback is when you hear someone saying, stop, shut up. It's like, shut up is like the worst thing you can say to somebody. Well, one of the worst. A negative feedback loop, the one that says shut up, is where it's always trying to get you back to the baseline. So the negative feedback loop is really a loop. So you have a change in your internal status, the hormones are released, and then there's a shutoff valve that turns off that production and brings you back to a natural baseline, a homeostasis. The perfect example of a negative feedback loop is within your home, in your heater system, where you have the temperature set to a certain level of comfort. And then when the temperature reaches that, for instance, when it's wintertime and the heat's produced and the temperature is right at where you set it, that sensor picks it up and turns off. So that is a negative feedback loop. And the whole point is homeostasis. Home as in your home, keeping everything at baseline. A positive feedback is something that is there to get the job done. So a labor coach, for instance, during labor and delivery is a great example of a positive feedback. Go, you're doing great, you're getting great. So for example, there's a disruption or you've got a job to do, your body responds and it keeps going until the job is finished. So bleeding, besides labor and delivery, is an example of a positive feedback loop. You break the skin, your wound, the breakage of the vessels releases tissue chemicals, platelets get activated, and this cycle keeps going until the wound clots and the bleeding stops. So that's a positive feedback loop. It keeps going until the job is finished. So here's a case scenario. You fall, you break your arm, you wait 4 hours in the emergency room, and by then your blood sugar is very low. Your body responds by having your adrenal glands release cortisol from the adrenal cortex. Your blood sugar rises and the cortisol production stops when the blood sugar comes up. So does the body's management of low blood sugar, otherwise known as hypoglycemia, use a positive or a negative feedback? So the answer is negative feedback. it's a good thing that this happens. So I don't want you to think of the terms positive and negative in that way, but it's a negative feedback. So as soon as the blood sugar levels get up, your adrenal glands stop producing cortisol, and your hypothalamus pituitary stop producing the precursors to cortisol production, cortisol releasing hormone, corticotropin releasing hormone, and ACTH. And that feedback system stops. So it looks like this: the hypothalamus, the anterior pituitary, and of course the adrenal cortex as a negative feedback loop. Things stop when enough is enough. Okay, here's the next scenario. Oxytocin released during labor. The baby is pushing against the cervix. It stimulates uterine contractions. Oxytocin's released, continuing more contractions. And that continues until the birth of the baby. So oxytocin is released during labor in this cycle until it gets a production of a baby, and that stimulation stops. So what type of feedback loop do you see oxytocin during labor? Is it positive feedback or negative feedback? The answer is it's positive feedback, because you're producing something, and once it's done, it's done. And this is where I was referring to earlier about the labor coach. Good job, keep going. That's a positive feedback loop. You produce something. So to give you a summary of the examples, the negative feedback include all these things, including cortisol, testosterone, all the thyroid hormones, calcium homeostasis. They are all part of your negative feedback loops. The only ones I can come up with that I have found are labor and delivery with oxytocin and blood clotting. The blood clotting cascade uses a positive feedback loop, keeps going until the job is finished. So it's pretty easy to remember. If you're asked a multiple choice question, whether it's negative or positive feedback, you have a pretty good shot at finding everything, just about everything except for two, are negative feedback loops. All right, let's go into stress, back to stress and stress management, thinking about those positive and negative feedback loops. And stress would be part of that negative feedback loop. So should you always try to avoid stress or anything that scares you? A, yes, always avoid stress. B, no, some types of stress are good for you. C, I don't know, I'm just stressed thinking about it. The answer is actually some types of stress are good for you. So I love this quote: do something every day that scares you. And I'll show you why. Do you remember, review, your hypothalamus is responsible for producing two types of stress response. The first type shown on the left is the stimulation of the sympathetic nervous system. And as part of that is the stimulation of the adrenal glands, the adrenal medulla, to release epinephrine and norepinephrine to go into that fight or flight mode. And the other kind of stress response is the one on the right, where it's the chronic stress response, where cortisol is released, raising your blood sugar for times of hypoglycemia, raising your blood pressure for when you stand up too fast. So two kinds of stress response. So I like to divide those into the adrenaline junkies and the worry warts. So with adrenaline junkies, you get the acute stress response and epinephrine is released. Remember, epinephrine and adrenaline are the same thing. With the chronic stress or the cortisol response, remember, cortisol is good when it's short duration, things get back to baseline. But the worry part that releases cortisol continuously is not good. So remember, epinephrine, also adrenaline, produced in the adrenal medulla. It's fast onset, it's very quickly gone, stimulated by those neurosecretory cells that drop the epinephrine and norepinephrine into the bloodstream. Cortisol, remember, cortisol is the lipid soluble, cholesterol based, slower acting, hangs around a while, a little bit longer. So it can be measured. And your level of stress can be measured by your cortisol levels. And the higher the stress, the higher the cortisol levels. So these persistently high cortisol levels have a detrimental effect on the entire body. Unfortunately, with our education system, that chronic worry does not help with learning. With people that have had their hippocampus measured with chronic stress, the size of the hippocampus actually gets smaller, and you need your hippocampus for learning and memory. It also causes multiple chronic inflammatory diseases. That chronic stress causes essential obesity, like you see in Cushing syndrome. It causes prediabetes because you're having this chronic state of elevated glucose. And with that, inflammatory diseases of heart disease causes inflammatory changes in the brain and dementia. And it also is a precursor for cancer. So this is comparing chronic and acute stress again. This chronic stress or prolonged cortisol levels, persistent cortisol, the systemic inflammation. This is the immune system, looking at the immune system, where fewer antibodies are produced when you're in a state of chronic stress. Cytokines are needed to respond to inflammation, infection, so your cytokines don't respond quickly. Versus the acute stress, the adrenaline rush, you actually see an improvement in your white blood cell responders. You get more antibody production and you get a better cytokine response. So basically what happens is with prolonged worry, prolonged release of cortisol, you will get an impaired immune system, versus a beefed up immune system will result from this intermittent acute stress. And that is why I say, do something every day that scares you. Next, the line between acute and chronic stress is always clear. True or false? And the answer is false. That is false. Say you have to get up, you are given an assignment that you have to get in front of the class and give a lecture, give a short talk. So the rush of doing the talk is good for you, but that chronic worry of knowing that it's coming up is going to increase your cortisol levels. So this is where I like to talk about shooting the second arrow. The best example that I think of is when someone yells at you and then chronic stress develops because your feelings are hurt and you keep thinking about that incident. So essentially showing Garfield the choice you have, the chronic stress, or getting yourself right back to baseline like zebras. So what are your stress management options? First question, what do animals do when they're fighting? Do they get bigger or do they get smaller? I hope you answer they get bigger. So this is measured. This is actually measured in people. And these are the body postures. Some people believe this is a controversial, but I'm going to present this study to you and you make your own decision. This is a Harvard researcher, Amy Cuddy, who did a crossover study. And what that is where they take the same people, they take a group of people, and for a period of time, one group takes one of these low power poses where they're sitting small. This is really typical of women, putting your hand at your neck, like almost protecting your neck from a predator, getting very small, sitting, being small. And then the other posture, it's a high power pose, is standing tall like the Wonder Woman. And each of these poses are held for 2 minutes. And after each pose, cortisol levels are measured. And she did this using saliva. So this is what it looks like, the methods of a crossover study. So the first period, you're doing a low power pose, then you have a washout period, wait, and then the second time you do a high power pose. And the results showed that these low power poses, where you're getting very small, you actually have increased levels of cortisol, where the high power poses drop the level of cortisol in your bloodstream. So the different types of power poses that she was using are things like making yourself large. So you can still be sitting, but a great power pose is like putting your knee, your foot across, your ankle across your knee, standing tall, having your chest open. And then these low power poses are the ones that make yourself smaller. So her conclusions were that changing your body position changes your level of stress. So your body is telling your mind how to feel. Your posture is telling your body how to feel. So changing the level of stress changes how you think and feel. And changing how you think and feel can change your performance. So think about your posture next time you're taking a test, you're about to have an interview, or you're confronting a difficult person, a difficult conversation. Okay, next question. Meditation also reduces cortisol levels. What's the physiology? Notice what posture this meditation. Also, yoga has some great postures. Does it A, increase sympathetic tone, or B, increase parasympathetic tone? The answer, it increases parasympathetic tone. So it decreases your stress. So a quick review of the autonomic nervous system, sympathetic versus parasympathetic. The sympathetic is your fight or flight. You're under stress. I like to think of S in sympathetic as stress. And the P, parasympathetic response, is peace. That's your rest and digest mode. So P is parasympathetic, peace as when you get in the yoga position. So when you get into this fear and stress mode where you've stimulated your parasympathetic, your sympathetic nervous system, your these two systems are essentially out of balance. Which, if you're acutely stressed, you're being chased by a tiger, you want your fight and flight mode. What happens with deep breathing, yoga exercises, postures, it in it invokes the parasympathetic nervous system, which cranial nerve 10. Remember, cranial nerve 10 is the wandering nerve, innervates multiple organ systems. But for this, it innervates the heart and the lungs. And when you take huge, deep breaths, it stimulates the parasympathetic nervous system. And that balances out the sympathetic nervous system and brings you back in balance. So looking at this innervation in the heart, the first thing, the stimulation of the sympathetic nervous system, fear response, increases the heart rate and also increases contractility. So your heart is beating harder and faster. And when you take a big deep breath and you may get these postures, you stimulate the vagus nerve, cranial nerve 10. The vagus nerve innervates the sinoatrial node, the AV node, and slows down heart rate and contractility. So notice the heart rate increases with the sympathetic nervous system and decreases with the parasympathetic nervous system. All right, so you can actually measure your own stress level without having the need to have your cortisol levels checked. And you can do that if you have any way to measure your pulse rate continuously. And if you have a smartwatch, a Garmin watch, Fitbit, you should be able to be measuring your pulse rate. And if you can do that in a continuous pattern during respirations, you can measure your level of stress. I personally use this Oura ring that measures my stress levels, and it measures it specifically during sleep and during the night. So it's measuring the pulse between using your finger. So this is a little precursor to what we'll be talking about in the cardiovascular system, but your heart rate is never exactly the same from beat to beat. You have a variability. So when your heart rate is measured, the number that comes back is just a average. But at any one time showing on this EKG, your heart rate can vary from 75 beats per minute or 60, and it averages out to 70. And what happens, just your normal breathing is what's causing this heart rate variability. So here, the breath in, faster, breath out. So this is what's called heart rate variability. It's used by athletes to determine whether or not they've overstressed their body the day before. They've pushed too hard, and this measurement will come out and say it's a day that you need to take off. So stress keeps the sympathetic nervous system activated. Parasympathetic is unable to slow the heart rate during a breath. And so you'll get a low heart rate variability as a sign of stress. So it could be illness, anxiety, or overtraining will give you a low heart rate variability, which means that your breathing is having little effect on slowing your heart rate down. So this is not a study. This is only a case example. This case is actually me. I'm using my ring and I'm doing a meditation session. So this is where the heart rate variability started out low at 25, doing a session of meditation, taking deep breaths. It jumped up to 50, 25 to 50, giving an average of 33. So essentially, reducing my stress, reducing the cortisol, and in theory, reducing the inflammatory response of your body to the excess cortisol. So this is just a screenshot of what the information the ring was giving and explaining heart rate variability probably better than I did in the previous slides. So heart rate variability provides a snapshot of your recovery and your stress levels. So when your body relaxes, your heart rate goes down, your heart rate variability increases. If your body is under stress due to intense exercise, strain, dehydration, caffeine, or being sick, your heart rate variability decreases. So if you have an iWatch, which I do as well, you can do this by using this little breathing app. I know you've seen this on your watch or your phone, but you've never thought to use it. But when you tell your phone that you want to do a 1 minute breathing, it will start the countdown of your heart rate. So you let it go for 1 minute. And this is what mine did on a day when I checked it just using my watch. The heart rate variability was very low at 17. And after 1 minute of these deep breathing, just using the watch, came up to 53. So great improvement. So you can do this, you can check it anytime, do it anytime, and you don't have to do a specific meditation session to see the improvement of taking deep breaths. So what we covered today were negative and positive feedback loops, stress hormones, epi, norepi, and cortisol, and stress management. Remember the feedback loops. The negative is what keeps you at baseline. And remember, most endocrine organs use negative feedback loops. That is when it's telling everything to shut up, enough is enough. And positive feedback loops, all you have to do is remember blood clotting and labor as the two examples. So they're handling that bodily threat of either bleeding or having a baby. The stress hormones, they're there to save your life. External stress, acute stress. And the chronic stress gets you back to baseline homeostasis. But if you increase your cortisol levels with worry, it's a maladaptive chronic stress response. So acute stress, remember, acute stress strengthens the immune system. It actually reduces hunger and it makes you feel alive. And this is just an image that was taken by a dive master when my husband talked me into going scuba diving in the Galapagos. He was up on a rock above us and we're down below holding on the rocks. And these are the Galapagos sharks that are circling around in this area. It's an area where there's a lot of food for the large animals. And you just sit down on the rock and watch them. In contrast, chronic stress does hurt the immune system. It increases hunger and it makes you feel spent, like these wilted flowers. And remember about the first and second arrow. Um, the Buddha is saying during a traumatic event, acute stress causes the initial pain or rush and the sympathetic response. The second arrow, suffering caused by grief, lament, remorse, guilt, and worry are chronic stress we call suffering that follows the acute event. So the actual Buddhist saying is, don't shoot the second arrow. Pain is inevitable. Suffering is optional. And mine is just breathe. Any questions? Please leave comments, leave your suggestions in the comment section and subscribe to my channel. The PDF link will be included in the description